Great. Let me know when you're ready.
I'm ready.
Great. Everyone's all good? Great. Well, thank you everyone for being here today to mark the completion of this hospital's fifth and final ward. This $317 million hospital facility was a long time in the making, so it's a great opportunity to mark two significant milestones that have been achieved here since the hospital first opened in July last year. More than 2,500 New Zealanders have had their elective surgery here, and more than 2,500 endoscopies have also been completed. The final ward which we visited will also increase capacity for women's health services from 15 to 20 patients, improving patient outcomes in a significantly enhanced environment. As Minister of Health, ensuring that all New Zealanders can access timely, quality healthcare is my top priority. Reducing wait lists so that patients have shorter wait times for appointments and surgery is a key part of this, and this hospital will play a critical role in delivering these targets. While there is significant progress needed to meet these targets, I'm pleased that patients in this region and further afield are benefiting from the state-of-the-art facility. This number will only grow as theatre capacity and resourcing continues to scale up over time. I want to thank all the staff here who are working hard to make that happen. I also want to acknowledge today Dr. Safati's decision to step down as Director General of Health and Chief Executive of the Ministry of Health. She has a long and distinguished career in health here in New Zealand and is an experienced and respected leader. Over the past few years, she has led the Ministry of Health during what has been a very challenging time while the previous government's reforms were being implemented. I want to thank her for her commitment to ensuring the health system delivers for New Zealanders and wish her all the very best for the future. And with that, happy to take questions.
Minister, obviously, this is the third senior health leader to leave within a week. What's going on? Are they clashing with you, or is there a clearing with the administration?
No, look, ultimately, my focus is on timely and quality healthcare for all New Zealanders and very much a patients-first approach. Look, these people have made their own decisions. I've been very clear we need to have the right people in all of the positions in healthcare so that we can deliver on those government targets and make sure that New Zealanders are able to access that timely, quality healthcare that they need. And I think there's been a lot of upheaval in terms of the last government's reforms. We're very focused on delivery and getting the system back to basics, back to focusing on the patient.
Was the Director General pushed?
No, look, ultimately she made her own decision here. She called me yesterday to let me know what decisions she had made. And look, I wish her all the very best in terms of the decisions she has made. She's had a long and distinguished career in health here in New Zealand, and I'm sure she'll continue to do so in her professional capacity.
And how was the Director General able to give just 1 week of notice?
Look, ultimately that's not a question for me. It's a question for the Public Service Commission, who are ultimately her employer. I just say, look, I'm very focused, though, to be focused on patients, putting them first. That's the outcomes that I think New Zealanders are wanting from their healthcare system. That's the job that I've been given from the Prime Minister appointing me as the new Minister of Health. It's very clear if you look across the country that there is a huge need to ensure that the healthcare system is delivering for patients. There are significant wait lists that have developed under the last government, and we need to get on top of that. This new hospital here is one of those great opportunities to do just that, but there is so much more that we need to be doing so that we can ensure all New Zealanders can access that timely and quality healthcare that they need.
And so Labour is saying the government is tearing apart New Zealand's health leadership. What's your response to that?
Well, look, they tore apart our entire health infrastructure by basically restructuring the health system during the middle of a pandemic. They couldn't have chosen a worse time. They got rid of the 5 health targets which were focused on patients, and they focused on bureaucracy. We are putting a patient-first approach back into our health system. We've put in place those health targets, and now we're making sure we're delivering against that so that New Zealanders can access the timely and quality healthcare. They need to look in the mirror as to what they did and the failures that they left behind with those incredibly long wait times, which are unacceptable for New Zealanders.
Are you concerned, though, that these ongoing leadership changes are creating instability in the health system?
No, not at all. I think there's a real focus from everyone I talk to, whether it's on the front line I've been talking to today through to the Ministry in Health New Zealand. They are focused on delivery. That's the message that I have been giving in terms of what my focus as Minister is. That's the focus the Prime Minister has given to me, is about focusing the system on delivery. This government has put in an additional $16 billion more over 3 years into our health system, a record amount of investment, and our expectation is that that system needs to focus on delivery and outcomes. And there are amazing people right across the health system who get up every single day and go to work to do just that. We want to empower them so that they can deliver what New Zealanders need, which is timely and quality access to healthcare.
Will we be expecting any more leadership changes somewhere down the line?
Well, look, ultimately what I'm focused on is making sure the system is delivering for patients. That's the focus of mine. We've got a real need to make sure that we're getting on top of those wait times, making sure our emergency departments are seeing people more quickly, making sure we're getting on top of those elective wait times. But if you look at what happened under the last government, they decided to restructure the entire system during the middle of a pandemic, focused on bureaucracy rather than patients, and we're bringing back a patient-first approach to the healthcare system. That's what I've been tasked by the Prime Minister, and that's what I'm doing.
Did Diana tell you why she was resigning, and did you try to persuade her?
No, look, she rang me yesterday to let me know her decision. I wished her all the best. Ultimately, as I said, she's had a long and distinguished career in health, across a range of roles, whether that's in the Ministry of Health, the Cancer Control organisation. She's had a range of roles. So look, I'm sure she's got much more to offer, but I wished her all the best, and the Public Service Commission will be able to answer any further questions.
But you didn't try to get her to reverse the decision?
Well, look, ultimately, I'm not the employer. She's employed by the Public Service Commission. My focus is on making sure that Kiwis have access to timely and quality healthcare. That is the focus and the lens in which I'm looking through every decision that I make.
Do you think it was difficult for a public health physician and cancer researcher to work with a government that's been actively hostile towards tobacco control?
Oh no, look, that is completely incorrect. I mean, we have invested, I think, over $600 million more into cancer medicines. We have, I think, rolled out another 19 new cancer drugs and treatments because of the investment we made. Labor didn't do that, we did that, so that we could ensure that more Kiwis could have access to more cancer drugs. And I think, I've been visiting hospitals up and down the country, meeting some of these patients, receiving some of these treatments, and they are so incredibly grateful for the investment this government has made in those new drugs, in those new treatments, and I'm looking forward to seeing more of those continue to be rolled out across the country to make a real difference in Kiwis' lives and to make sure they can get that treatment in a timely and quality manner.
Labor's also said the Prime Minister appears to be getting rid of anyone who disagrees with his handling of the health system. How do you respond to that?
Look, I mean, they're on a different planet. Ultimately, they decided to restructure the entire health system during the middle of a pandemic. I could not think of a worse time to do what they did. The system is still grappling with what they've done. Wait times have blown out. When Labor came to office in 2017, only just over 1,000 Kiwis were waiting more than 4 months for an elective surgery. That's now over 50,000. That is unacceptable. That is something that we need to fix, and that's one of the areas that why we put those targets back in, so we can focus the system on ensuring Kiwis can have that timely and quality care. So we're putting patients at the centre of every decision we make. We're taking a patients-first approach to healthcare, and that's the focus that the Prime Minister has given to me and that I'm taking with every decision that I make.
In the debate the other day in Parliament on Margie Arthur's resignation, you talked about your commitment to targets, and you mentioned that people want to know if they have an appointment
Yes.
with a GP, they can get to see them in a timely manner. But that's not one of the targets. So are you looking at that as a potential target?
Well, we're getting advice on what's more's needed in primary care. I mean, I think if you go and talk to emergency department doctors up and down the country, the fact that people are finding it harder to access their GP is leading to more people presenting in emergency departments. And so that access question is something that we are receiving advice on what needs to be done to support primary care to be able to do more.
And you looking at a potential target?
Well, look, I'm not here to say. I'm here to say, look, that's an area that I've said very clearly is a focus of mine. Primary care. We're looking at what we can do to support primary care to be able to ensure that people can get timely access. And what we're seeing in our emergency departments is people turning up later, sometimes sicker. And that's meaning that it's taking longer for them to be seen. So when you look at primary care, what more can be done there? That's clearly one of my priorities, and it's also about putting patients first so they can see that timely and quality access to healthcare that I think every single New Zealander expects and deserves. Great. Hey, well, thank you very much. Thank you so much for coming, and all the very best for the weekend. Thank you.
Thank you.